No, this is very passionate to me because I've had children. He's gone to a therapy center and come back with a problem rather than solving his problems. I try to explain to the parents we need to start very early doing all kinds of treatment which are possible because there are people who want to wait and go slow. You have to undergo therapy, undergo proper treatment because what is important is. Hello, Namaste, Salam Alaikum, Sat Sri Akal. Dr. Naeem Sadiq, neurologist, neuropsychiatrist, founder and director of Plexus Neuro and Stem Cell Research Center.
Welcome to the Dr. Brain STEM podcast, your portal to understanding the complexities of neurological disorders. In part 2 of the podcast, we delve deeper into understanding and managing neurological disorders like ADHD and ASD. Together, we're committed to raising awareness, enhancing knowledge, and exploring how this condition affects the daily lives of patients and their families. Guiding us through today's discussion is Ms. Kanishka, a seasoned occupational therapist with a master's in occupational therapy and the head of the Department of Rehabilitation.
So you see so many children with ASD and ADHD coming from diverse backgrounds, different socioeconomic groups, different cultures from all over the country, all over the world, in fact. So what is it that you see as how do these conditions impact the families, and what is the impact of these conditions on the family dynamics?
Yeah, that's something which I want every practitioner, everybody, I use the word practitioner, anybody who deals with these kids should keep in mind. Here, when the child is suffering, when the child has any of these problems, it is not just the child. It is the entire family which is enveloped in the problem here. Like, for instance, when the child is having either of these problems, either ASD or ADHD, the amount of stress, the amount of emotional trauma and psychological problems these parents go is unimaginable. First is the stress. I'll have to handle this, I'll have to take care of this, I have to take care of the child's special needs. Just imagine the child needs special food, the child needs this kind of food, the child needs this kind of temperature, the child needs every single thing, this child needs everything. It's not easy. The stress, the anxiety. Because of the increased sensitivity, suddenly the neighbor, Diwali, the fireworks, the child is gone, the lights during any of the festivals. So the anxiety, what will happen to the child when such a function happens or when we have to go for any of these events. So emotional and psychological problems, stress and anxiety. The second common thing which I find in these parents is the guilt. Guilt in all aspects. One guilt, is it because of me or is it because of my wife? Is it because of my family or is it because of her family?
They're always searching for an answer.
Searching for an answer.
Why did this happen?
And at times blaming each other. That is one section of society where they tend to blame either of the spouses, families, for producing such a child when it's not true. Guilt, will I be able to do all these things? This child developed a problem, maybe because of this reason. Especially in the last 4 years, I have seen 90% of people who come to me because of COVID, we could not go outside. We kept the child locked in the 4 doors.
We didn't give enough time to the child.
We didn't give enough time.
That's something I've heard.
Both the parents were working from home. And during this working from home time, it was not that 8 hours, 10 hours. People were working for 12 hours, 14 hours, anytime the call comes, anytime the mail comes. Maybe because of that. Or there are a lot of families who have gone to some other country where I've had a lot of people from the Middle East We were staying in this country where we didn't have anybody who would speak our language. Because of which this happened, we came here to make money and we lost our child. Blaming themselves for that, or going away from the joint family network. We all grew up normally. We never heard of this problem earlier. It's so common. Because we are staying in Australia, because we are staying in US, because whichever country, we went there, stayed away from the grandparents, from the uncles and aunts and cousins. The child does not know how to mingle and socialize and speak the language. So, blaming themselves and the guilt, which is huge. And I'm sure you will understand this since you see these people along with me. We both are busy, both are on the system doing work. So the child is crying, the child needs us, we can't, so we give him the phone.
Yeah.
Screen
time.
So the child got used to the screen because of us, which is not the case. I keep explaining to all of them, even before 2020, we had these problems. Even before 1980, when the TV came, these problems were there. So these things have just brought them out. So there's no need for you guys to feel guilty about it or blame each other or blame yourselves because of this. Such a thing happens. Now, what stems from this, if you look at it from a different angle, is the relationship gets strained.
Yeah. I personally have come across so many parents who are not on good terms with each other. Interpersonal relationships get affected and they're literally on the verge of separation after the child's diagnosis.
Exactly. Because the husband wants to pursue his career, do all his things. He cannot take care of the child. The wife equally wants to pursue her career, do all those things, and this is your child, you take care of him. This is your child, you take care of him. Constant friction, constant fights, arguments, and this is so common. They either get separated physically or at least mentally they're aloof.
Yeah, I think almost all the parents we've seen.
We see that every single family, and it's I don't know whom to blame and how to address this, but then I want both the parents to understand. It is my child.
It's a shared problem.
It is my child as much as my wife's child. This child belongs to both the parents. If something good happens, both of us say, okay, my child won this trophy, my child got this. No, it is our child. I think that "our" goes off from the dictionary when the child is diagnosed with any of these disorders. So the emotional, psychological, interpersonal relationships, and it may not be confined to just husband and wife. It may extend to his family and her family as well. Then this may have impact on other things also, like social isolation. Now, I have this child. I cannot invite anybody to my house.
Sorry, before we go on to that, even the siblings.
Siblings, yes.
I've also seen in a few cases, I remember these twins who come to us. Both of them have ASD and they have an older brother who is like a third parent. So this child actually lost his entire childhood taking care of these two twins who are on the spectrum.
Yeah, that's one aspect where the older child takes care of them. There are other cases, if you see now, the one we are treating right now, where the child without a problem is neglected because the parents are giving all the time to this particular child. So this child who is not suffering starts developing that inferiority complex.
Yeah.
And then grows up with that, I'm not getting attention as much as my brother or sister gets. So the siblings also get affected here.
Coming to the social isolation.
The social isolation I was talking about now, which affects the siblings, everyone else also here in a way. We cannot invite anybody to our place. And I cannot take my kids and go and have a family get together, friends all get together with
It's
their
a
family.
nightmare.
It's a nightmare. Absolute. One parent has to stay at home with the child, only the other parent can go. Or they have to keep a nanny, or I've seen the kind of traumatic things which happen in these families are unimaginable. Besides these now, and because of this, the careers get affected, wherein there are so many couples I see here. One person has to give up the dreams of rising up in a career, has to take some part-time job or work from home, have limited hours of working, and there are so many people who have quit their jobs.
Yeah.
Either it's not only the mother, or in some cases mother has quit the job.
Nowadays we see both.
There is a lot of cases
Yeah.
where the father has quit his thing. He's at home taking care of the child, so the career gets affected. No, because of this, one leads to the other.
It's a domino effect.
It's a domino effect. These children need therapy.
Yeah.
These children need treatment.
Therapy is expensive.
Therapy is expensive, extremely expensive. In India, still it is affordable. But then when you look at countries which are outside India, it is unimaginable. People are able to afford 1 session per week, 2 sessions per week. Somebody is giving 3. Oh my God, this guy has money.
Yeah.
That's how it is. So the financial implications which are there. So all these things bundled together have a huge impact on the child and the entire family.
So when you sit with these parents, how do you counsel them? What do you tell them?
Yeah, it's very interesting, but very, very difficult. Very difficult. Well, I straight away start off with what I have seen all these years. Yes, you have a child with a problem, which, like I started in the very beginning of my session today, it is not a disease. It is a disorder, number 1. Number 2, it is not your fault or her fault or her family or his family. It had to happen. It happened. There are various hypotheses which have been there. We don't know which one is true, but we need to accept the fact, okay, this is our child who is having this issue. But then, what I always see in these children is those exceptional qualities which they have, which are amazing. I try to explain to the parents, we need to start very early, doing all kinds of treatment which are possible, which can bring the child back on track as soon as possible. This is very important. Because there are people who want to wait and go slow. But then the child is 3.5-year-old. You have spent 6. I have cases now which you're seeing now 12 years.
Yeah.
Non-stop therapy has been going on. Still the child is where he or she was. So you have to undergo therapy, undergo proper treatment, and then the child can be brought back to a large extent if detected early and if treatment has started early. So there's no reason to feel sad, bad, mad about this. It has happened. Let's try to correct it. Let's accept it. And then I go on to explain the process and the right way, the right approach for these kids. Not just random things. Because what is important is the time. We cannot pause the child's age and plan the therapy. The child is growing and the problem will also grow. As the child grows older, 6 years, 7 years, 9 years, 10 years, the child has already become 55 kgs and 5 foot 6 inches. You can't hold him. The child does this and the mother falls.
Yeah.
We have had cases here.
Yeah.
the child screams and then the entire neighborhood has to just sit quiet. So start the treatment as soon as possible, and the correct treatment, the proper treatment, to see to it you bring the child back on track as soon as possible. Plus, try to explore those exceptional qualities which this child has and groom. Do not be stuck on this. This is something very commonly I found. Will my child go to a normal school? Will my child be able to finish his 10th standard? Not necessary. Only people who go to a school and finish their 10th standard and their 12th standard and their graduation are intelligent. No. These children can be geniuses. They can do exceptionally well in whatever field they choose, and they choose because it's their special interest. It's not that I stop this and I'm forced to fall in line where I don't belong. This is what I go on to tell all the parents. Yes, there are quite a few parents who like my approach and they go with that. There are some who want to follow the same track, then I say
they don't like.
Yeah, okay, it's your way, and you do what you want to, because I'm not with that, because I don't want the child to suffer. I want the child to bloom, and these children can bloom into flowers which are unimaginable. These are my words, and I've seen it. I've seen. I cannot tell you what are all, the kinds of cases I've had. Oh my God, I just need, I don't know how many months or years to keep talking about these cases. So accept, try to repair, and you will succeed if done properly.
So talking of therapies, you said therapy is expensive. So what are these therapies are you talking about?
Yeah. The therapy, okay. So the therapy here, number one, the most important is occupational therapy. And in occupational therapy, what I have found the greatest success in all these children is the sensory integration therapy.
So good to hear these words from a neurologist.
I talk, like for instance, now you're asking me, I'll just give you a simple example. You're talking to me, you asked me a question, I'm answering, the temperature is very nice, ambient, no noise, people are not entering, walking, everything is controlled. You asked me the question, I understood 100%, and the answer which I give you, you will understand 100%. Now imagine the situation where I'm talking to a child, a whiff of dirty smell comes there, or the lights start flickering, and there's this loud noise outside, somebody's bursting crackers there. The door opens, 4 people come inside, somebody's pulling my shirt, somebody's touching me here, and I'm talking to you. How much will you understand?
Hardly anything.
And what will your reaction be?
No response.
Yeah.
Or confusion.
Or you get agitated, get angry. Because so many things are happening at the same. That's exactly what happens in this child's mind. All the sensory things are creating havoc. The light is disturbing, the sound is disturbing, and the other person is not understanding. He's trying to sit and make the person talk and sing Baba, black sheep. What the hell is this Baba and what the hell is black? I don't care. I want all these things to come under control. So, first and foremost, unless you do the sensory integration, you will not achieve anything. It's my blanket statement.
I hope everybody out there is listening to this.
Yes.
Especially all my OT friends are listening to this. How important is eyesight?
Children come to me. We have been doing therapy from 5 years. What are you doing?
Building blocks.
Building blocks, or they have a fancy thing there where you have rings. There's the red ring, the yellow ring, and the green ring. Put those rings there, and they sit and make the child talk. The child sings, Baba, black sheep, doesn't know what's the meaning of Baba, what's the meaning of black, and what's the meaning of sheep. They have a piccolalia, and they might do certain things in it's like, I'm sorry to use this word, but like training your pet. Something similar to that, which is wrong. First and foremost is sensory integration therapy. So like what we do at Plexus here is, based on the child, based on his or her problem, we customize the entire therapy. Some children we give 100% sensory integration, some we might give 80 of that, a little bit of occupational or a little bit of cognitive, depending on the sensory profile. But unless the sensory comes under control, we cannot proceed even one step further. Then yes, speech therapy. After the sensory comes under control, then we have the cognitive therapy, where the child's brain is filled with data and the child starts analyzing. And we have the physical therapy and behavior therapy. These are some of the, it's a whole lot of therapies, but mainly sensory integration, which comes under OT, speech therapy. We may subject the child to some physical therapy if needed in certain cases. Then yes, behavior therapy and cognitive therapy wherever it's needed.
We also have special education services
Yes.
wherever required.
Yeah.
We need to work for academics and
Yeah.
improve academic performance.
So which we do as well.
Yeah.
Plus now there are a lot of schools which are inclusive schools where you have these facilities. Special education is also very essential for these kids.
Yeah, even group therapy. Yeah, so I would just want to use this opportunity to make a point here that only licensed practitioners and specifically occupational therapists can practice sensory integration therapy. Sadly, it has become a big business now, and anybody and everybody is doing SI without knowing what is SI. Just the fact that you put the child on a swing or put them on the trampoline, just leave them there, 10 reps of this, 20 reps of that, and you do the same thing for every child, you're only spoiling it. You're only spoiling their sensory system. You're just making them worse. So I just want to thank you for, talking so much in detail about this topic, because nobody talks about it, especially from the medical fraternity. I've never heard any doctor speak about.
No, this is very passionate to me, because I've had children who have gone and done therapy, what you are mentioning, swing, trampoline. A child without the vestibular problem has gone and come back with a severe issue. He's gone to a therapy center and come back with a problem rather than solving his problem. So it's a very, very important point which you have brought here. So unless you know what you're doing, don't do. You might spoil the child's the entire sensory system. Issues which the child didn't have might surface. We have had some children who we had modulated the entire thing. They went to another place and suddenly we saw all the vestibular have come, and on investigation found out that the child was just put on the swing and the ayah would come and keep swinging for the entire 30 minutes, disturbing the entire system. So yeah, it's very, very, very essential.
So apart from these therapies, what role does diet play, and what is the role of lifestyle changes in the management of these conditions?
I like the way you framed your question. Apart from therapy, right? So this message should go across loud and clear to everybody. Without therapy, nothing can be done. Therapy is mandatory for these children. Mandatory in capital bold to everything.
Very true. So many parents feel diet will cure
Yes.
autism.
There is nothing in this world so far, maybe in the next few years, few decades, some medication, something might come, we never know. But as of now, as of today, nothing can replace customized, proper therapy for these children. Intensive, And it is not once in a week. It should be a proper regular therapy depending on the child's problem. So besides therapy, there are a few things which have been spoken about. There are lots of things which have been propagated about, and many more which have been marketed about. But what has found to be really a little bit here and there evidence with a few children, one is what we call as the gluten-free, casein-free diet, GFCF diet, which is like,
Very
big
fancy,
thing,
yeah.
very fancy term. People throw that around. Well, that's one kind of diet which
It helps them.
it helps. Second is what is described as the anti-inflammatory diet, where you have no sugar, no processed food, lot of whole grains, lot of vegetables and fruits. Now, if you look at this diet, this makes sense.
Yeah.
This goes more into a healthy, nutritional kind of diet. So this is good. But what I propose and I tell all the parents, number one, have a balanced, nutritious diet. See to it, there are certain things which the child may not like or child system may not tolerate. I have lactose intolerance. Milk and dairy products my system may not accept. Don't give.
Yeah. Don't force feed.
Don't force. I'm sensitive to gluten. Don't give the child stuff containing gluten. That is my theory. There are so many other things. Give him nutritious food and a balanced food. Period.
So basically identify the triggers.
Identify the triggers, which is very important. And what parents should do is maintain a diary. And see, when we went and had that particular ice cream, the child had this problem. Now, what were the ingredients of that ice cream? Or when we went and ate that particular sweet from this place, the child had a problem. So what were the ingredients there? So if you see, like whenever the child has cheese, this is happening. Stop cheese.
Yeah.
That's about it. Now, while I was talking about the sweet, one thing which we have found very common is sugar, which I was talking again in the anti-inflammatory. Sugar and sweet products there's a lot of evidence where they're found to increase the hyperactivity of children. So I ask all parents to stop sugar and any chocolates and sweet things. So there is nothing called one specific diet which suits all the kids. No. What suits me may not suit you. What suits you may not suit somebody else. This particular child is eating. It should be nutritious. It should be healthy. And let go about it. Don't go wandering and searching for some one leaf which grows on the tip of Himalaya mountain and say, okay, this will cure my child. It will not happen. Stay at home. Find a good therapist. Do therapy. Child will become better. Yeah. That's about diet. And in diet, hydration. See to it the child, because the child will not know I'm
Never
thirsty.
ask for water.
Exactly. Child will not know what is thirst. The child will not know what is hunger. So make it probably a habit or a routine that child should keep drinking water every so many minutes, or some kind of system where hydration is taken care of. Then coming to lifestyle. So these children have a routine. One, maintain their routine. Don't disturb it.
Yeah, respect that.
Respect that. The child wants to do things in that particular way. Do it, unless it's costing you too much in terms of emotion, time, physical, these things. Try to see that you respect and keep that routine. The child is fine. Like I ask all the parents, I ask them, what time is your child best? I will try to give you those timings for the therapy. The child wakes up at 11 o'clock. I'm calling the child at 9 for therapy. It doesn't make sense at all. So I try my best to respect at Plexus here, to try to give all children the time when they are comfortable with. Respect their schedule. Maintain their sleep, proper sleep. The child has to sleep at 9 o'clock. Child is sleeping there. You're playing loud music in the next room. Or you're lying in bed next to the child with your system on, the light and everything from the system is disturbing the child. It will create problems. The other major concern here is the screen time. The children are so addicted to screen.
Yeah.
Assessment becomes very difficult. We just cannot. The parents come inside with the child. They cannot talk. So forcibly, okay, they give the phone to the child. Okay, he's sitting quietly. Now we can talk to you. That's how life has become.
Yeah.
Best option is if you can stop the screen time completely. Or if it is extremely difficult, what I tell the parents is to schedule it. Have a fixed time. Or link it with this, A plus B plus C, then 20 minutes of screen time. That works in most of the cases, but then it takes time and patience and persistence.
It will not happen overnight.
Impossible. Believe me, you have seen it happen. The first 8 days, 10 days, they did. 12 days, we just couldn't manage.
Yeah.
We had to give. I think that's the 12th day is important. Maybe you had you continued the 12th, the 13th, 14th day, you would have stopped. So persistence is very important. So lifestyle, these are the lifestyle changes which they have to bring about.
And they work in coalition with therapy.
Yeah.
What else? What about physical activity?
Physical activity is equally important
for children.
In different ways. Number one, physical activity is very important here because quite a few of these children have issues with their gross motor function, which can be integrated by doing this. 1. 2, some of these children may have some other sensory issues. By doing physical activities, those sensory issues can be modulated. 3, like I've been talking and everybody in this world knows about it, by doing physical activity, so much of imbalance in our neuroreceptors gets sorted out. So physical activity is very important for these children, in fact extremely important. If you're talking about a child with ADHD, he's running around random, bizarre, without any purpose. Structure it. I keep making games and things like that for parents and tell them, why don't you just do this? Father, mother and child, they spend 1 hour doing that physical activity. I just get benefits like mad. 1, the family bonding. 2, they're spending so much time together. Husband, wife and the kid. 3, the child's entire hyperactivity is now getting channelized in one direction. So once he burns it out, after that he'll just sit and do his homework.
Stay calm for some time.
Stay calm, listen to you, help you in the kitchen, come fold his clothes, make his bed. So many benefits you get only by one activity. It is very important, yeah.
Okay, so talking about ASD, now there might be some children who are introverts. They don't want to talk to people, they don't want to go out and play. They're happy in their own world. So how do you differentiate between a child who's on a spectrum versus a child who's an introvert?
Interesting, very interesting question, yeah. Now, if you take the child who's an introvert, he's introvert. He likes his own company. He's sitting. He comes from school, does his entire homework, keeps the book inside, starts maybe preparing for the next day as well, makes his bed, goes to sleep, gets up in the morning, goes to the classroom, does his entire homework, everything, finishes by 3:30, 4 o'clock, comes home, does not play with anyone, does not mingle with anyone, there's no chatting, no friends, but he's doing all his work. All the ideal setting, all his daily activities are being taken care of. He's not disturbing anyone. He's not getting disturbed by anyone, by any of the environmental factors. What we've been talking about, the light, smell, sound.
Yeah.
He talks normally. He calculates, plans, does all his activities. The only issue he has, he does not socialize with other people. He might talk to his siblings. He talks to his parents. He shows his emotions. He goes, hugs them, and the parents come and hug him or get angry. He understands. Emotions he understands. His cognition is okay. His speech is okay. He does not have any sensory sensitivities. The only problem in him is he does not mingle with a lot of people. That's what it is in introvert. And a child with ASD has everything else besides this.
Along with this.
Yes, along with this, he not only is on his own, he does not understand emotions, he does not speak properly, he does not do his daily activities, his eating is disturbed, he may not even know how to indicate his toilet needs. That is ASD. So you cannot compare
the two.
Yeah. It's only social. That too, when it comes to strangers and outsiders, at home you might be all right. There are times that even at home, there are other brothers who are talking, joking, running around, all. Now this child just wants to sit quiet and keeps looking at them. That's fine. That's okay. He's an individual. That's his personality. So let him be happy. Well then guys, Dr. Naeem Sadiq from Plexus, from the channel Dr. Brainstem, signing off. Thank you for joining, for discussing this such an interesting topic on neurobehavioral disorders. If you have any questions or if you want me to discuss any topic related to the brain and mind, please post them on the channel and I shall be only happy to answer them to you. Now till then, bye-bye.